A country split in two. This was the situation in Mali in April 2012. In the south, a fragile government. In the north, armed Islamic groups. MSF's teams arrived in January 2012 and began working at the hospital in Tomboektoe in April. They were also supporting the region's health centres.
Dès que les nouveaux maîtres sont arrivés dans la ville de Tombouktoe et en
As soon as the armed groups arrived in Timbuktu, and indeed across the region, MSF established a dialogue with them to try and ensure the safety of our staff and patients.
Bien sûr, avec l'objectif d'assurer la sécurité de notre personnel et des patients.
Access to healthcare was already difficult in the region before the conflict began, and became increasingly more so by the day.
Il n'y a pas eu des épidémies, on n'a pas pris en charge des milliers de gamins avec.
There weren't any epidemics, but we treated thousands of kids with acute malnutrition. There was clearly a severe lack of health care because of the change in the security situation.
Et il y avait un départ quand même des cadres de certains hôpitaux.
The managers of certain hospitals and health facilities left, and there were problems getting hold of medical supplies, so the health system was seriously disrupted. Our working there was absolutely crucial.
Notre présence était plus que indispensable.
The military intervention by French and Malian troops in January 2013 led to the armed groups' withdrawal from Gao, Kidal and Tombouktoe. But the situation has not yet returned to normal. Medical staff are in no hurry to return to the north. Prices have rocketed and security remains of great concern. The 460,000 people displaced within Mali or living as refugees in neighbouring countries have no intention of returning home. And yet they are still living in highly vulnerable conditions. In Mabera in Mauritania, more than 70,000 refugees are living huddled together in the middle of the desert.
Our children are sick and it's hard to find medicine. There aren't enough latrines and we're short of water.
Water, food, medicines and healthcare, especially for the children and pregnant women. The needs are immense and there's not enough aid to go round. A nutrition survey conducted by MSF in November 2012 showed acute malnutrition rates of 17%. In Mabera and also in Niger and Burkina Faso, MSF's teams are providing care for both the local and the refugee population, and they are likely to be needed here for some time to come.